Hi everybody, Colleen here. I thought I'd do an update on how I'm doing. So I had my occipital nerve decompression surgery January 8th. I had the revision February 12th because I had a dehiscence. The wound opened up. So it's May 27th, 28th, something like that. And I just wanted to check in and let you know how I'm doing. So nice. I always start with the hair. I don't know, but my hair is growing back. It's getting pretty good. You can't see the scar at all, so that's good. I'm gonna say that probably in the last 7 or 8 days, I was starting to feel my nerves coming back on board. You know, after the surgery, your nerves are completely numb. Like you can't really feel the back of your head. It's really kind of an odd feeling. But I'm starting to feel sensation in the back of my head. Sometimes it's itching. Sometimes it's sore. I have to say that I feel like my head's been like really sore lately, and in the back, and also like the very bottom of my neck and my traps. So interestingly, not everybody does physical therapy after they have nerve decompression surgery, but I am. So I just started today actually, and we just, we did the evaluation. I had to answer some questions, and he really just like kind of massaged and kind of felt the tissue. It turns out my traps are like really, really super tight, and I forget what he said, but my muscle is not sliding very well, especially on the right side. My range of motion is more limited on my left side than my right, but it's limited. It is limited looking up. I definitely feel like stiff that way, and some pain. It is limited looking down. And then you can kind of check this out at home for yourself too. You know, how far can you look to the right? How far can you look to the left? Like when I'm driving, thank God for cameras now, because I have a really hard time like turning my body and turning my head around to like look if I'm backing into a space or something like that. And then also, check out this. How do you do this? This is tight. The left side, actually, I can go a little bit further, but the right side, I can feel that. So it was really interesting as he was working on different parts of my upper back, lower neck, like I could feel like shooting, pains in different areas. So I do think the nerves are definitely coming on board. So what does that mean? Well, I'm going to see my surgeon in July. By then the nerve should be back. And then we assess like, what's my level of pain on a daily basis? I think he said 80% of people get 50% or more of pain relief. So 50% of pain relief would be great. So we'll see what it is. I have to say that right here, really even right after my surgery, a couple weeks after, I started to feel like significant pain here in this like back left quadrant. I'm not sure what that is. It does not travel down. It is definitely like maybe a 4-inch by 4-inch very clear area there. I'm not sure what that is, but when I do cognitive stuff, it gets worse for sure. And when I have an episode, it gets worse. So how am I doing overall? I feel good because I've done more tests. I got my cognitive results, which I went over with you guys. They were somewhat worse than last time. That doctor said that could be that I have, so it'd be interesting to look that up, persistent post-concussion syndrome. So that's basically having the symptoms of a concussion like long after the concussion should have been over. So I'm 2.5 years out and here I am still having concussion symptoms. I did talk to my brain injury doctor. She is going to start me on speech therapy because I do have issues, especially when I'm having an episode. So I'm waiting for that script. I'm going to start speech therapy, and I'm going to do the neck therapy to strengthen and make my neck more flexible. When I'm done with that, then I do the vestibular therapy. I have to say, and again, a lot of people that have this surgery, they just have occipital neuralgia. I have vestibular migraines too, so it's complex. But I have to say, since that surgery, my balance has been worse. Those nerves that he dealt with have nothing to do with my balance, but it could be just pain and trauma to my head. I don't know. But I have fallen a few times, which is a little bit scary, mostly on uneven ground in my backyard. So I don't know if I'm having binocular issues or depth perception issues, so I might have to see a neurologic ophthalmologist. So that might be coming, but we'll see. But that's part of it. Part of vestibular migraine is not your body not knowing where it is in space. So that could be. I was working on a greenhouse, and I've noticed that in a greenhouse I have trouble kind of orienting inside of there, because they're kind of like, they're not glass, they're polycarbonate panels, but they're like fuzzy kind of. So it gives you a weird perception of where you are. So I have to be really careful when I'm in there for sure. I started walking around the block probably about a month ago. So I do walk around the whole block with the dogs. I'm doing much better, like bending. I can now bend over. I can lift some things. I do get still head pain. I get like neck pain in my upper traps. If I carry something like 30, 40 pounds, it's like too much still. So I'm going to talk to my PT and see what that's about. But you know, here I am, let's see, January, February, March, April, May, 5 months out. I'm starting to get my nerves back on board. I am feeling pretty good. I do have migraines almost every day, but again, I don't think I'm normal with that because I have the vestibular piece and the post-concussion syndrome and all that stuff. So, you know, those of you who are thinking about it, again, my doctor, Dr. Ahmed Nasser, he's on Instagram. He does a lot of educational videos. He's awesome. So you can look him up, and it's called the Plastic Surgery Center and the Reconstructive Center, and they have offices in, I'm just trying to think, in New Jersey, in Red Bank, Shrewsbury, Brick, and I'm sure somewhere else. But yeah, Dr. Nasser, like, this is his jam. This is what he does, and he's very, very good at it. He lets you ask a million questions, teaches you about it so you understand it very well. So I felt very much like I was a partner in my treatment and my surgery. He did say I might have some kind of neuralgia here. I'm not sure if that's trigeminal or something else, but we're going to look at that, because I do get really bad pain in my head and my eyes. From jump, I would say like my eyes hurt or my eye sockets hurt. So that could be a different kind of neuralgia. So anyway, I'm trying to do better. I do a little bit and then I have to rest, and that's just how my life is. If I'm in a lot of pain, then I have to, now I can ice, now I can use heat, but ice is the magic. Ice is really the only thing that works to take the pain away. So we'll see how it goes. So far so good. You know, we'll see how I do with the physical therapy. I would say after my first physical therapy visit today, I was pretty hurting, like uncomfortable for probably 3 hours, like not good. I still don't feel great. I'm probably like a 5, where I was maybe a 7 after PT. So, you know, that's part of the deal. Like, you got to do the work to get better, but you know, you might be hurting, or there's things you might not be able to do for a little while. So that's really it. I'm getting better with natural light. I still have a lot of trouble with fluorescent lights, and noise is a nightmare. Loud noises are a nightmare. When someone mows the lawn, they have a leaf blower, loud cars, motorcycles, like, forget it, game over. That alone can cause me to have an episode, and then I have trouble talking, walking, and I have a bad headache, all the things. So I do have actually like engineers, I don't know, coverings for my ears, and I have to get new loops. But yeah, I basically travel with headphones and earplugs, like everywhere. I have to say that the last 3 days were really, really, really bad. Like, I had really bad migraines. I think it's because here in New Jersey, we had storms. We had like rain for the last 3 or 4 days. And yesterday was like, I guess it's the barometric pressure. It really affects me. So I do have the WeatherX earplugs. So you can get the WeatherX app on your phone, and it kind of warns you when the barometric pressure is going to change. And you can put these earplugs in that help your head and your body deal with the changes in the barometric pressure. Just kind of an interesting thing to know. So anyway, I will probably check in next week, and I might even see if I can video my speech evaluation when I do it. We'll see if they let me do that. But anyway, so that's where we are. Thanks everybody, and I'll see you soon.